Good morning and hello. I am super lucky to have with me here today Laura Friesen. She worked as a physiotherapist in hospital for many years before stopping due to health concerns. It was in 2013 that she got her diagnosis for chronic Lyme disease. And Laura's here today to tell us how that diagnosis led her to the Anat Baniel Method NeuroMovement. I am so excited to hear your story, Laura. Thank you for being here today.
Thank you for having me. I'm really excited to be here and to share my story.
Yeah, just jump in, tell us.
Yeah, so like you said, my background is a physiotherapist. I worked, in various hospital settings for years. But back in 2012, I started having some odd neurological symptoms and I first brushed it off just to overwork. I use my hands a lot for my job. So some joint pain in the hands, some numbness. I treated myself and it would go away. But then things just kept on building on and I realized something was wrong. I was one of the lucky ones. I got my diagnosis probably within about 6 months, which some people go years without finding out that it's chronic Lyme disease. But I was working with my family doctor. He was really good searching things out, but we couldn't figure it out. And then I started seeing a naturopath. I've always loved natural healing. So I sought out a naturopath, and sure enough, he was knowledgeable in Lyme, and that's, he was the one to nail it down. I live in Canada, so we have public health care. It's great, excuse me, in many ways. But for Lyme disease, it's really lacking up here. So I worked with my naturopath. My family doctor was supportive, but he was very limited into what he could do for me. So I went down to the States actually to find help.
Wow. So was your naturopath in Canada or in the States?
Yeah. So I live in Manitoba, so central Canada. So he was also here in Manitoba, but he recommended that I go see a doctor who specializes in Lyme, who herself actually is a Lyme survivor. And so that's where she dedicated her practice to. So I went down to northern New York State to see her. And however, like you said, I did end up quitting my physiotherapy practice. My health was such that I knew I needed to focus on myself. I needed to take time off from helping others heal. And then just, to throw it all in, my husband and my two oldest children, my two boys, were also diagnosed with Lyme probably within a year of my diagnosis. So now I was working on my health, finding something to help me. And then I was also in charge of their health and managing their medications, their natural treatments, all the appointments. And when I say my boys, they were, I think, ages 6 and 8 at the time. And then I had two younger children yet as well. So I'm busy mom of 4. 4 out of the 6 of us have Lyme.
Wow.
There was many reasons why I decided to put my career to the side. So yeah.
It's a full-time job managing all that.
It was a full-time job managing, everything, all of our health, all the appointments, my Lyme doctor and my naturopath and my family doctor too, all amazing. So we did traditional treatments of like antibiotics and stuff like that. I was willing to do anything. I'm a young mom. I need to be able, my youngest at the time was 2. Like I had toddlers, I had elementary school age kids. So I did some traditional stuff, but I also did a lot of natural stuff. Like we changed our diet, which was, a full-time job in itself.
Oh, yes.
Our family still eat eats pretty much gluten-free. My husband still has to be dairy-free, egg-free. So like I'm reinventing the wheel for a lot of
Everything.
things. And so
That's
we
a
did a lot of
lot to
natural things,
do.
and the natural stuff often required, natural supplements or tinctures, 4 times a day. It was a lot, but we did it. And, I'll talk more about the details, but I hit remission, yeah, by about 2017. And yes, and my kids are doing great. It was only about a year of treatment for them, and they haven't had symptoms since, and they're doing fantastic.
Wow.
My husband's had it the longest, and so he's still dealing with it now.
Right. But in taking care of your own health and your family's health, you have a stronger base from which to support him.
Oh, yes, definitely, right.
Yeah.
By working through my health, and now after all of this, I'm stronger. I am stronger in body, spirit, mind, which ABM has all led to, which, yeah, so we'll get, I guess, to that.
Right. So
Um,
so let me rewind a bit because I'm
mhm,
thinking of I have friends with Lyme and everyone's Lyme story is a little different. So for you it
very.
was the joint pain and
Yeah, so for me, my initial symptoms was pain in my hands, um, numbness.
okay.
At first it felt like I had just, pinched a nerve. And so I would
Hmm.
go see my massage therapist and I would feel better. And I was like, okay, it was just a nerve. And then it went from one arm to both arms. And I was like, hey, well, that's not right.
Hmm.
And then, so I saw her again. And when I was on the massage table, my legs went numb. And I'm like, now I knew that there was something very much more than just a pinched nerve.
Yeah.
From the nerves, I also had sinus issues, a lot of
Hmm.
infections. And then it just kept on progressing, the neurological symptoms. I had nerve pain, like
Oh
it
no.
wasn't muscle pain, it wasn't joint pain, it was nerve pain, which there's not a lot of medications to help you for that.
Mhm.
Um, and a lot of muscle fatigue, like I was getting some muscle weakness, like I had,
Mhm.
after the birth of my youngest, she's now 2, I had returned to work, I was starting, a good workout routine. It got to the point where even lifting 1 pound weights was too much for me.
Wow.
Um,
Wow.
yeah, so my muscles would just fatigue really quickly. So, which was another concern for me. In 2013, I was still safe working with my physiotherapy clients, but I didn't want to get to the point of putting myself at risk or them as well. And
That's a huge consideration.
it is a huge consideration, but in 2013, I started antibiotics, and really that took away the very worst of my
Okay.
neurological symptoms. But what a lot of people with Lyme will tell you is it also affects mental. Um,
Mhm.
a lot of, we call it brain fog. Like
Yeah.
until the brain fog lifted after a few years, I hadn't realized how bad it was living in like essentially a very cloudy world. You had to think really hard to get your
Mhm.
thoughts. My thoughts would often evaporate and disappear, and I'd be like, what was I thinking? I was
Mhm.
just saying it. I couldn't. Um, there was times of depression, of course,
Of course.
with chronic disease and not being able to do what you used to do.
Right.
And then it also affected my personality. Like I'm a very laid back, calm person, and there it was very easy to trigger me. And
Mhm.
like the slightest thing just felt like it was a mountain that I had to climb. And so there, a little bit more anger or frustration, and like I said to my husband, I'm like, what's going on? This isn't
Yeah.
me. And I felt so guilty for a lot of these emotions until I realized it was all Lyme. And I'm like,
Yeah.
I'm still me, I just have to fight this infection. And the
Mhm.
me came back. But it's and everybody's different. My husband's
Everyone's
symptoms were different from mine. There's some similarities. My boys presented a little bit differently,
mhm.
and so there's a reason why it's so hard for doctors to pin it down as a diagnosis because everybody is different.
Yeah.
But just to keep on, searching, right? And finding
things that
the
work.
answers.
Yeah.
Mm-hmm.
And one of those things that worked for you was neuromovement. How did you stumble onto
Yeah.
neuromovement?
So that's interesting. My husband's cousin went through the Anat Baniel Method, practitioner training, and
Cool.
she lives 45 minutes away from us. And so when she finished her training, she was looking for, people who were willing to try this. And with my background as physiotherapist and my interest in health in general, I was like, ooh, I want to know more. And the other thing is, by the time I saw her, a lot of my Lyme symptoms, the really serious major ones, had kind of subsided or they had gone away. But I knew that it had done a lot to my neurological system. And I was like, I'll take anything that, could help.
Absolutely. Yes.
Also, my husband was, has always had it rougher than me for the Lyme. And so I was like, I want him to try it, right? Like I'll do anything to help my family too. So we did it. And I was like, oh, I like these changes. I like how I feel, right? The, more relaxed feeling at the end of a session is beautiful. And the way Brooke had explained it to me, I was like, yeah, like, right, if I can learn how to move better in more well-organized and efficient ways, I'm going to have more energy, right? Because I was still dealing with a lot of fatigue. I was still napping every day. I still have 4 young kids. I'll do anything to try and have more energy. And so through the awareness that I got of, different habits I had, like I realized, oh, I often would clench my teeth while focusing. And trust me, clenching your teeth doesn't help you chop carrots any better, but you're using more energy. And so, yeah, right. So then it was just part of my healing journey and gaining more energy and more resilience, and I could handle stress better.
Oh, nice.
Yeah, so then I fell in love with that. And around this time that I found ABM, my husband and 2 of my kids were also diagnosed with ADHD at this time. And so once Brooke started working with children, I said, I need to bring my kids to you. My kids didn't like their medications. The side effects of the medications, at times were horrendous. And so they started seeing her. And if a doctor would look at my kids now, there would be no ADHD diagnosis. They're just normal, healthy, active kids. And so when now all of a sudden there's 4 of us needing this work, and I was like, wow, you know what? I'm feeling healthy now. I'm like, this is what I want to do. I want to be able to help my family, but I can now take my physiotherapy background and, all my education, and I can still use it now just in a new way, in a way that I've fallen in love with. Like, I love the philosophy of ABM, and it's everything I wish I had known when I was a physiotherapist. Because there was times where I'm working with clients and their pain's not getting better. And, I would try something else and I would be like, what am I missing? And I'm seeing that now with my ABM clients. It's like, this is what I'm missing. In the last few months, I've really been thinking about this. And as a physiotherapist, I thought of muscles, I thought of joints, I thought of the diagnosis or problem and focusing on that. And now when I work with my clients, I'm like, I'm so excited because I'm like, I'm not thinking individual joints, muscles, bones. I'm thinking the brain. How can I speak to the brain? And by speaking to the brain, these changes are amazing and life-changing for them. And it's been life-changing for us.
Yeah.
I love it.
So let me make a few connections here, because really one way to think about what you're saying is that we're focused when we use neuromovement on the health of the system.
Yes.
right? And that is really what you were focusing on from the beginning. When you stopped work, you stopped work to focus on the health of the system, right? Because it wasn't just you, it was your whole family. It, you took a moment to step back and address the needs of the system. You weren't just going to target the one little problem. And this bigger, this stepping back and taking a bigger view of things actually allows you then later to be able to say things like, if you looked at my kids now, you'd see just healthy, normal children, right? Because you weren't, I'm sure when you took them to Brooke, was it Brooke?
Yes.
Yeah.
Yes.
You weren't thinking, get rid of the ADHD. It was more of like, what can we offer them so that their brains can continue to grow in a way that supports their health, supports their life, supports their freedom to live.
Yes. Yes. Right. It gave them the freedom to be who they are, right? Instead of being told you need to change, or this is where you're supposed to be. I was like, and they too just loved the feeling of just being in themselves and centered and not, distracted by everything going on. And that's what I love about it too. I have that feeling too, just being centered, being who coming home to yourself, which kind of brings me to like this past year. COVID has been crazy for everybody. But just pre-COVID, my husband was feeling better. We decided we wanted to go after some dreams. And so we decided to move across the country to the West Coast. We bought ourselves a business. This was all in fall of 2019. My plan was to, help with the business a little bit and then do my training to become a practitioner. And so that's what I was doing. COVID came, a lot of stresses. And so with Lyme, like I say, I'm in remission. Major life occurrences can make Lyme flare up and come back, like reemerge. And that's exactly what I did for my husband. He was so sick last summer from just all the stresses of learning a new to us business. I had bought an established business, but it was new to us. Yeah. COVID, the move, everything. He became so sick, we decided to actually sell the business and move back to where our family is in Manitoba here. So within a year, we moved across the country twice. We bought and sold a business. I was going to school pretty full time while working, anywhere between 40 and 70 hours a week at the business. My Lyme did not come back. I felt actually by the end of the training, so after the end of at the end of like the 13 months of training that we had, I felt stronger. I felt the resilience that I gained from doing this work.
Yeah.
Like I was able to do what I needed to do, support my family, do all of this. And then lo and behold, with being sick with Lyme, I had to end up going on thyroid meds years ago. My thyroid had stopped functioning very well. I got off of my thyroid meds in the middle of a pandemic under all this stress, and I'm feeling great. Like
that's fantastic.
Healthier than before Lyme. Like for me, that's the testimony of this work. Like it's not just taking away aches and pains, which I didn't have, but for me, it's been a whole mental, resilience and just overall, like you said, the whole system is working well and working together. And it allowed me to do what I needed to do this, through this past year and a half.
Yeah. That's fantastic news. I'm super happy for you. And I'm sure people listening to this are thinking, wait, do I have to go through 13 months of training to get what Laura got?
No, they can just come see one of us.
Okay, so let's talk about that. When you saw results for your kids, was it after one lesson, two lessons? How does this work?
Yeah, when a client comes sees me, I can't tell them what their outcome from that one session is going to be, but people see changes after the first one.
Mhm.
For my kids, we would do what, is called intensive. So we would do, 2 lessons a day for, 3 or so days, and just let that learning from each lesson build upon
Yeah.
itself.
Mhm.
Um, Due to time constraints, we didn't do it often, but you know what, it was enough. It was enough, but it was also me as a parent and my husband as a parent shifting our mindsets as
Yes.
well, with our
Mhm.
kids, to help them grow and blossom into the wonderful children, human beings that they are.
Yeah.
Um, but I know now, if I am feeling some aches and pains or something, or even my husband, and if I do one of the floor lessons, or transformational movement lessons, I feel better instantly. My headache will go away. I will feel calmer.
Mhm.
It's just a reset, and the rest of the day is great. My husband still deals with a lot of pain with his Lyme, so
Mhm.
then I'll give him one of the lessons. Let him lie on the table, and I'll give him a lesson, and then he,
Yeah.
he gets that reset as well. Takes that, either the edge off the pain, or just takes the pain away, for the next while.
Yeah.
But yeah, I've seen it in my clients too, right? Like they'll start seeing changes after each lesson, and but for some people, if you're dealing with chronic pain or a chronic injury, it can take a few lessons, or um, I tell my patients, it's like, well, if you've lived, with
Mhm.
these movement patterns, and and you're, let's say, 50, well, you know what, we're not going to change 50 years of movement patterns right away, but you are going to see changes, and you are going to start feeling better, and they do.
They do. It's true. And it's interesting because it's funny and it's wonderful to be talking to a physiotherapist who's been on both the medical and what I would call the educational side, because what we do is education.
Yes.
Um, and it's interesting because I think the medical model really ties us into putting everything on a fixed timeline. And if you aren't meeting certain
Yes.
milestones, I mean, you know it from the hospital, you had to tick certain things off, meet
Yes.
certain metrics.
Mm-hmm.
And and I understand why those things need to happen because bureaucracy. But the downside is that our culture has taken that and said, "Oh, that's how human beings should be." And guess what? That's not how human beings are. So it's always fun for me to hear stories, to share stories with my audience about how short or how very long the process might take. Because, as you said, everyone's nervous system is different, everyone's history is different.
Yes.
So I'm encouraged by the fact that you said that your family got results right away and that you're seeing more results the more often and the more long term you do it.
Yeah, it's even though, like I said, our training was 13 months, like there's still so much more learning for my body to do, right?
Yeah.
And so yeah, it's a never, or like,
Yeah.
I love learning, and so I will keep on going until,
Yeah.
until I can't anymore. But um yeah, investing in yourself, and taking
Yes.
that time,
Mhm.
is huge, right? And we often will,
Mhm.
say someone else is more important. Like, before I
Mhm.
did the training, I always put my husband and my kids, I'm like,
Oh,
okay, well,
yeah.
you guys can go. We don't have enough time for like all 4 of us, to get lessons, but you guys go, right? And
Yeah.
it worked, like it worked for them, but I just knew that I needed this time for myself as well. But as a parent, of a child that has health needs, you tend to put them first, but as a parent, you also have to invest in yourself. And so this work has changed me as a parent, has changed how I parent, and has made me healthier. So I know it's kind of hard sometimes to, put yourself first as the parent, but I would really challenge parents out there to try it yourself, like not just take your child to an ABM practitioner, but try it yourself and see how it can impact your life and make you, a better version of you and a better parent and take some time.
And you're touching on a subject that's really important. I think that what we learned from this isn't just physical. By taking the building blocks, the 9 essentials that create the conditions in the brain for neuroplastic change to occur, if we can take them out in our lives get that much better. It's not just our bodies and our movements, it's our lives, which is, I think, part of what you're saying. Am I right?
Yeah, it is. Like I said, like it's affected my resilience. So like, you don't react so much to like stress. And so just having that calmness, right? For anybody, parent or not, is huge. But just you taking those 9 essentials and using them in your life, whether you have children or not, but how you approach a problem or a decision you need to make, to slow down, to, think through different possibilities, variations. I use it in parenting. I wrote a blog post last month on my website about teaching my 16-year-old how to drive using the 9 essentials. And my husband had looked at me after, we've been driving for a couple of months, and he's like, I never thought you'd be able to do this with him. I have, when I was younger, a teenager, I did. It wasn't a serious car accident, but I had managed to get my car to roll in the ditch. And after that, I was always a little bit more anxious, as if I wasn't in control of the car, holding the side door, this and that. But I was like, what? I'm like, this is a new skill. I'm like, how can I make his experience easier than what I remember when learning how to drive? And what can I do? And I'm like, let's use the 9 essentials. So it's like breaking things up into little bits, I'm like, okay, we'll just do like 2 variations, and then we'll build the next lesson. We'll just do 2 new things on top of that. And just being slow and giving him the freedom to learn. I felt it was it was as easy as it could be teaching your 16-year-old how to drive. But it was my mindset, right? Like, it's not that I was doing some magical, linear, if you do A and then you add B, you're just going to magically get C. But it was my mindset. So I was like, you know what? I'm going to give myself permission to be calmer, to, go through these 9 essentials. And, if I'm less stressed, the new driver beside me is going to be less stressed, and it's going to be an easier learning time. And then, watching for that learning switch, because I could see, when he was getting to that point where it's like, what, even if it was only 5 minutes, but it's like, I'm saturated. I'm like, okay, we're done. It's like, we don't have to have, a set time or, that you have to achieve these goals in order to learn in that driving session. So something just kind of neat and everyday that, a lot of us end up going through at some point.
Yeah, that's fantastic. It's a beautiful story of how the 9 essentials just apply in day-to-day life. So you go to lessons with Laura, you absorb some of the 9 essentials with all the goodness on the table. And if you start applying them outside of lessons in your day-to-day life, you will see changes. So we don't know what changes, but you will see changes.
Yes.
You will see changes. So how can people get in touch with you? Are you giving lessons from home? What do you do?
Yeah, so I have space in my home. I have a studio in my home that I do see clients. I do also do some travel. So if I, can work it into my schedule, if it's not too far, I, I will try and accommodate clients as they need. I have my website, or I'm part of Evolve Movement Canada. So Evolve has practitioners all across Canada, from the West Coast in BC all the way to the East Coast in Prince Edward Island. I'm in the middle. So going to our website, which I'll provide you a link to our website, can get you in contact with me. I also have an Instagram page, just a personal Instagram page that I, post some tips and what I'm up to, move and learn with Laura.
Mm-hmm.
And yeah, so clients can call me, email me, through Facebook or Instagram, and we can set something up. I also, in fall, I'll be starting my online TML, the transformational movement lessons. I do love teaching online as well. Have seen fabulous things from my clients. They enjoy it. And so I'm looking forward to starting that back up, which all that information will be on my website as to when the classes are and dates and times.
Yeah, and you can drop links in the
Yes.
comments below so people can find you. That's
Yes.
fantastic. So before I move to our final question, is there anything else that you had really thought would add to this discussion?
Oh, I think I've covered most of, we've gone pretty in depth.
We have.
Definitely, yeah.
Cool.
Yeah, go ahead. Just ask your last question.
I will ask my last question and then feel free to add on if you want
I
to.
will.
I just ask that so no one feels unfinished.
Yes.
So you've been through your whole family almost having Lyme or some kind of tick-borne disease. What pearls of wisdom do you have for someone living with chronic Lyme?
Yeah. So one thing is don't give up. Like, because everybody, each person who deals with Lyme, our symptoms are different. I had so many doctors tell me that there was nothing wrong with me, or with my son or my husband, or they just brushed it off. And I, from the stories I hear, this is very common for people struggling, like with the chronic Lyme, right? Like if you get bit by a tick and you have that classic bullseye rash, which doesn't always happen, by the way. You don't always get a rash with the tick bite. But if you've been bit and you start, you have the rash or the flu-like symptoms, just go and get the antibiotics. If you catch Lyme quickly, like the cure rate is really good. The antibiotics do work well for that first initial. It's more when it gets to that chronic stage, like it did for our family, right? Like we do live in a tick area, but back in 2012 and earlier, Lyme disease wasn't talked about. People didn't know about it. Like people know about it now, but I met many healthcare practitioners, of various sorts, who had no idea Lyme existed or denied that it existed. And so when it gets chronic, it's harder to diagnose because, everybody's different, or it can mimic so many things. So don't give up. Like, even if people are telling you that they're, like that what you're feeling isn't real, what you're feeling. You're going to be your best health advocate, and don't give up, and just support yourself with a supportive team, whether it's family, friends. Find one, a couple of healthcare practitioners who won't give up on you. Also, one big learning thing. Okay, so as a physiotherapist, if I was working with people with chronic health issues or long-term things, I would give the advice. It's like, what, don't try to overdo, like you pace yourself, right? Because this is a long, if it's a long-term, diagnosis, chronic thing, and like pace yourself because you need to work on energy management. So I preached that for years, and then I dealt with Lyme, and then I started feeling better. And when you start feeling better, you want to start doing all the things you haven't been able to do. Well, then that would send me back to bed because I overdid it. So it's true. I think in our culture, like getting stuff accomplished or doing has, is always promoted. And I just want to tell people, give yourself permission to do what you need to do. And if that's need to rest, it's okay. It's a really hard lesson to learn, to be okay with saying no to things, to protecting yourself and say, what, this is for a season, and this season, I can't overextend myself. And it's okay to say no, or, to say, what, I need, it's like, if I don't rest, my body's just gonna stop, working well. Give yourself that permission to slow down. Again, one of the 9 essentials, just slow down and just be that advocate that you need for yourself. And it's okay to do that. And then one little pearl for, if you are a family member or a friend of someone with Lyme, please be patient with us, right? I just said we need rest. We sometimes need to say, no, we can't attend this social event, or we can't be on this committee. Be patient with us because we do need to take that time for our health. We wish, right, that we could do everything we did before, we got sick, or do more, but just be patient with us. And if you know someone with Lyme, don't be afraid to ask permission to help out. Ask, when can I bring you a meal? Like, or, can I come mow your lawn for you? Like, make it tangible, because when you're in the thick of Lyme, it's really hard to put those thoughts together. And if someone's like, oh, well, how can I help? Well, thank you so much for being willing to help, but I can't think of what I need right now. So if you see a need, don't be afraid to ask. And then, if a person says no, okay, well, that's fine, but you've asked, you've made it clear you want to help. But so often I didn't know what I needed. I couldn't say, right? It's just like, but if someone would say, you know what, I want to bring you a meal, or even once, some of my friends had a really hard time. We were on so many diets. That was so hard for people. They didn't know how to cook for us. But you know what? I had a friend just come over and bring me flowers. Like, just seeing fresh flowers, on my table, it's like, oh, somebody cares, right? They actually took the time out. So it doesn't even have to be a big thing. But, if whatever your gift is, if you can find a way just to say, you know what, can I do this? Or can I watch your kids, for an hour so you can sleep, or whatever. That would, just to give an insight for those who don't, like, Lyme is a very invisible disease. Like, my husband and I looked healthy. And so people would think that we're fine. But in reality, we were for years just treading water, trying to keep our heads up, right? So it's hard when it's an invisible disease, because, if you have a cast on a leg, people know, okay, well, they broke a leg, there's something obvious there. But in Lyme, there's nothing obvious, to show you that we're struggling through something.
Right. Those are great pearls to share. I'm sure people are going to get a lot out of listening to you and hearing your story, and hopefully they'll get a lot of hope from it too. Because
you know, I'm doing great, right? There is hope, right? And it took a gamut of, it took years, it took a lot of different trialing different things. And that's why I say, don't give up, right?
Yeah.
You know, keep on working to find what works for you. And there is hope.
Well, thank you so much, Laura, for joining me here at Move and Bloom, a safe space where together we can grow possibilities. I'm certainly hopeful for all of my friends with Lyme, and I'm so glad that your journey has been a positive one. I hope we see you again soon.
Thank you so much.
Bye-bye.
Bye.